Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Irritable Bowel Syndrome. Irritable Bowel Syndrome, more accurately known as Irritable Bowel Syndrome IBS, also called functional colitis, intestinal neurosis, spastic colon syndrome, affects between 10% and 50% of the adult population, mostly women. It is a totally misunderstood disorder, which is often blamed on nerves. You can hear phrases such as, "But the doctor told you that you have not got anything, that it's just a story. You are very nervous and that's why you have irritable bowel syndrome. You know you don't have anything. Well, you don't have any disease." The diagnosis is quite atypical. Irritable bowel syndrome is what doctors call a psychic functional disease. That is to say, there is no organic correlate that allows them to diagnose it. For this reason, it is attributed to the nervous traits of the person. It is a disease by exclusion, when all kinds of tests have been carried out, such as analytical tests, colonoscopies, retroscopies, opaque enemas, etc., and other pathologies have been ruled out, the patient is normally labeled as IBS. Irritable bowel syndrome is a disaster box into which any person with digestive problems who cannot be given any other diagnosis can enter. Depending on the severity, for one person, it can mean only a slight discomfort, and for another, it can have serious personal problems, social and/or work-related. Most common symptomatology: severe pain in the abdominal area, usually relieved by going to the toilet, gas, diarrhea, constipation, alternating periods of diarrhea and constipation, feeling of fullness, full stomach, fatigue, incomplete evacuation of feces, at least this sensation, mucus in the stool, general discomfort, especially in the early hours of the day. In most cases, only a couple of symptoms. Normally, there are very few cases where all or almost all of the symptoms are present. In any case, a differential diagnosis must always be made by the specialist doctor in the digestive system. It is essential to rule out pathologies such as cancer, Crohn's disease, ulcerative colitis, etc. Up to 3 basic types of irritable bowel syndrome can be established, depending on the symptoms such as alteration of the intestinal rhythm, with predominance of diarrhea episodes, with a predominance of episodes of constipation, diarrheal episodes constipation. Causes: irritable bowel syndrome is usually associated with 2 types of neurosis caused by the stress of today's society. That is to say, there are alterations of motility and/or digestive sensitivity, influenced by psychological factors, anxiety, depression, or the combination of both, anxious depressive. Stress usually attacks or affects the patient's target organ. If the continuity of such stress persists, it can provoke the appearance of a neurosis. Anxiety or any disorder derived from it, such as agoraphobia, or anxiety crisis, among others, or by the appearance of depression, or a combination of anxiety plus depression. All of this further damages the patient's target organ. Now, let us imagine that the target organ is the digestive system. This suffers continuously from this neurosis, thus causing the appearance of various disorders at the level of the digestive system. If the doctor does not find anything at the organic level, by exclusion, he will diagnose IBS. Now the Pandora's box has been opened. That is to say, everything that happens to the patient will affect his target organ and thus further increase his IBS. The patient enters a spiral of difficult exits, as the doctor will treat the symptoms: diarrhea, constipation, abdominal pain, avoidance of certain foods due to allergies or other intolerance to certain food products, etc. Forgetting the cause of IBS, that is to say, nerves. But nerves are not the cause either, but rather how the patient sees life, how he or she copes with the various situations or events that arise throughout his or her life. Here we would enter into cognitive restructuring, so that the patient structures his thoughts in a different way, because his way of thinking has led him to suffer from IBS. Stress has a negative impact on people's health. Continuous states of stress contribute to heart disease, digestive, hormonal, and mental disorders. Stress disrupts the proper functioning of the organism. The symptoms of IBS are usually triggered by emotional stress. Therefore, this syndrome is a functional disorder, which means that the tests performed do not reveal a disturbance or injury to the structure of the bowel, such as an obstruction or a tumor. Under appropriate conditions, if we are in distress, stress-induced changes instantly prepare us to respond in a timely manner to make our lives safe. Many people, in the midst of dangerous situations, develop unsuspected strength, leap over great obstacles, or perform prodigious maneuvers. Stress. Therefore, stress is a physical and mental response to adaptations to various life events. Now, when this stress is intense and prolonged in time, it becomes a problem for the sufferer, both on a physical and psychological level. That is to say, what in appropriate situations can save our lives becomes a mortal enemy when it is prolonged over time. For many, overcrowded conditions, economic pressures, work overloads, the competitive environment, etc., are circumstances that are unconsciously perceived as threats. Stress. Brief episodes of stress disrupt the functioning of the organism. However, the symptoms disappear. When the episode subsides, this happens more easily if the person possesses effective tactics, appropriate strategies to cope with stress, and if he or she expresses his or her feelings normally. When causes of stress appear and the patient's resources are inadequate to overcome them, the target organ suffers, digestive system, increasing with it the symptoms of IBS, emotional, mental, physical, and behavioral symptoms. In this case, the patient should be trained in appropriate coping strategies. When the stress is sustained, that is to say, once the alarm phase has passed and the stress continues, it is established these physical affections target the weakest organs of the person, which are called target organs, because they are the ones that receive the darts of stress. That organ gets sick, and if it is not taken care of, it can lead to cancer, and with that, to death. Symptoms of stress. Emotional symptoms: anxiety, depression, irritability, fear, guilt, mood fluctuation, confusion, or turmoil. Mental symptoms: excessive self-criticism, difficulty concentrating and making decisions, forgetfulness, worrying about the future, repetitive thoughts, excessive fear of failure. Physical symptoms: tight muscles, cold or sweaty hands, headaches, back or neck problems, sleep disturbances, tachycardia, hypertension, nausea, upset stomach, flash and infections, fatigue, rapid breathing or palpitations, tremors, dry mouth. Behavioral symptoms: stuttering or other speech difficulties, crying, impulsive reactions, nervous laughter, rough handling of others, teeth grinding or jaw clenching, increased use of tobacco, alcohol, and other drugs, increased susceptibility to accidents, increased or decreased appetite. Prognosis. IBC is a chronic process from a medical point of view, where one observes asymptomatic periods followed by frequent relapses. In general, it is associated with a good prognosis, with life expectancy, mean the same or similar to those who do not suffer from the syndrome. The problem lies in the quality of life. That is to say, the quality of life is worsened in practically all spheres by the symptoms suffered and their imposed limitations. Social limitations: abstention from work, reduced physical activity, negative perception of their health, feeling of chronification, etc. If you're interested to continue learning about clinical hypnosis, watch our next video, Irritable Bowel Syndrome Part 2. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comment area. About this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.